And so, Dr. Polly, you mentioned that there are unique situations that arise when you're treating military spine patients. Let's start off by talking about what that means.
Well, first off, I think of the military population similarly to the professional athlete population. They have to be able to physically perform to do their job. And we talk about how tough it is on the football field. Well, I would talk about how tough it is on the battlefield, where you say it's a life and death situation, and it is a life and death situation. They have to be able to carry remarkably heavy loads with their rucksacks. They've got combat equipment, and they are under fire and sprinting to and from and in terrible ergonomic positions and situations. They don't have a choice. They've got to deliver. And so that is a unique performance envelope, and it doesn't matter if, oh, I've got a lifting restriction of 10 pounds. You pick up and carry your buddy off the battlefield or they die. And so that's the kind of environment that they have to perform in. And the other piece is they're highly motivated. They are generally in pretty darn good health, and they are really motivated to go back and do what they've got to do in order to accomplish their mission.
I think that really speaks to the uniqueness, though, of the population. A few of the things I think that are different, having practiced in the military system for 10 years and then having practiced in the non-military system for 10 years, is really the needs and goals of the patients are much different. One of the things that I can tell you is that, not just from the population being relatively healthy, we did a lot more motion preserving surgeries, cervical disc replacements, operations in terms of if the patient was a pilot, that's a much different to be a fighter pilot than flying for Delta or American Airlines because there's certain types of surgeries that you can't have in order to be able to fly and be a fighter pilot in the military. And in addition, other job considerations, whether getting deployed into theater, are also considerations in terms of sometimes we choose surgeries to get that patient back to health, but also so they can perform their job in the military. And it's much different than the considerations that we have in the civilian world at this point. I think the other thing that we realized is that, especially with our soldiers and sailors and Air Force and Marines who deployed into theater, the injuries that they had that they came back with from the combat were much, much different than we see in civilian populations. And so one of the things that we always talk about is that military healthcare really advances a lot of medicine. And so over the last 20 years with the wars in Iraq and Afghanistan, things like prosthetics and different things really increased and improved, but also did spine care. We published on some of the largest series of disc replacements in the neck. We published the largest series of low lumbar burst fracture, which is a fracture that happens very classically up between the junction of the chest and lower back. But the military population was much lower because of the types of injuries they would have, and also certain fractures of the pelvis. We talked about earlier stress fractures, but these were fractures that were significant down in the pelvic region that really just don't happen in even civilian trauma. And so I think all these things really coming along, the population is different, the goals of the patients are different sometimes, and also how we treat them have to be a little bit different.